New tonight at 11, it's a problem some California mental health professionals experience every year. Patient dumping leaves mentally ill people on a one-way ticket to unfamiliar places. 23 ABC's Carlos Correa, he's live in our studio with more on how ground transportation seems to be used more often to send these patients away. Carlos.
Troy, bus stations are often the address found on discharge papers, and mental health advocates say it's an easy practice, but it's also very immoral that can cost counties thousands of dollars. Dr. Jim Waterman is familiar with the term patient dumping.
We actually had somebody arrive at the bus station and they were 5150, put on an involuntary hold by law enforcement because they were wandering around the bus station. They didn't really know where they were disoriented and a danger to themselves and others.
A few years ago, it was a practice happening too many times in Kern County.
It really is an attempt to get the person out of that hospital's jurisdiction. Maybe the hospital's not going to get paid for those services, or the local treatment entity is overwhelmed or whatever. So it's kind of a classic strategy that's really considered to be very unethical. But it happens.
Patients with mental health problems found in cities not familiar to them can cost counties up to $230,000 a year if a person is sent to a state hospital.
It just seems so irresponsible.
Patients often end up in homeless shelters, and leaders with a center in Sacramento recently had that problem when a man was dumped by his provider.
He was just very scared and lost and confused.
California Senator Darrell Steinberg promises new legislation. He's writing the U.S. Secretary of Health and Human Services requesting a federal probe into interstate patient dumping.
Because of their disability. I mean, that's the reason why they put them on a bus and said, here, you're somebody else's problem. That to me violates civil rights.
There is a current agreement in Kern County that was set a few years ago to allow treatment of dumped patients only if those providers sending people agree to follow up and get patients where they're ready to leave care. In the studio, Carlos Correa, 23 ABC.